Greetings, neighbors. This is Reflections, a religious affairs show sponsored by the Paducah Cooperative Ministry, where we, all of us together, do God's work with human hands. My name's Gregory Waldrop, and I'm the pastor at Fountain Avenue United Methodist Church, and I'm one of your co-hosts here on the Reflection Show. I'm joined today by my co-host, Karen Winkel, from the United Church of Paducah. Welcome, Karen.
It's good to see you, Gregory. I'm excited today. We have two very special guests, and I think on this program we'll be talking to the guest who's traveled the furthest to be on Reflections.
I believe that's
today
right.
We're going to be talking with David Okung'o and Paul Bilak about Project Aids Orphan. We've had Paul and his wife Monica on before, but this is a special day for us because David has come from Kenya to meet with partners in love in Paducah who are helping make a difference in David's community. So welcome both of you. And David, I know you've had just a little bit of chance to get oriented to life on this side of the planet. So a special welcome to you today.
Thank you very much.
And you've had a little bit of Southern food, I hope.
Sure.
Well done. Well, tell us about your all's relationship. How did you first meet Paul?
Yeah, I met Paul maybe 6 years or more ago in Kenya. He came to Kenya as a missionary, working in a mission station, and then I was working in the mission hospital. And I used to work in community health, where we used to go to outlying clinics, where we could go and see patients in rural, remote areas. And Paul joined me to drive me there, and we had a good time. We talked of many things: life issues, family, challenges, problems, and issues. And I don't know how God connected us together and we became brothers. So that's how we met in Kenya.
Lovely. And you were on the mission field, right?
My family had lived in Kenya for 3 years. I'm a nurse practitioner by trade, as is David, and he was actually my supervisor at the hospital. And as we're about the same age, both married to lovely women who happen to be school teachers, children of about the same age, so we had a lot of things in common. And we've been asked often this week how we became friends, and I'm not sure how we did. At this point, it just seems obvious that we were going to be friends.
Great. So you've been partnered in this AIDS Orphan project for a while, and in relief for the community, the local community from which you hail.
Sure.
Tell us about that. Tell us.
Well, as we would travel to these remote clinics, it seemed that it always took us 3 hours to get there and 3 hours to get back. And almost every week we would drive out to the clinics and we'd talk about sports and politics, and those conversations wore thin after a while, so we started talking about our families and things that really mattered. And David shared that one of his brothers had died from HIV, as had that brother's wife. So David then had the responsibility to care for those children. And when we had an opportunity, my family would help his family. And then when we came back to the States, my extended family wanted to help his extended family. And as people in Paducah heard about what we were trying to do, our community wanted to help his community. And so we asked David actually to do some investigating and find out just how significant the challenges were. And then we started Project AIDS Orphan, which is an organization that we describe as Africans and Americans working together to address African problems with African solutions.
Neat.
And that's one of the things that really stood out for me, because I remember the first time I heard you speaking, I was kind of eavesdropping really on a conversation. And the thing about that, the effort itself is so significant, but what really spoke to me was the way in which this particular effort is respectful of and attentive to the Kenyan way of addressing these issues? Because I know often Americans can be well-meaning but project onto other cultures and other countries ideas and expectations that are distinctly American. And that is something that I continue to respect, that this truly is a partnership in which you are listening as David really teaches you and those on this end who are involved what it is that's most fitting. But that can only come out of the kind of relationship that you clearly have that is born of love and respect. Mm-hmm.
What are some of those ways, David, that you're impacting the AIDS orphans there in West Kenya?
Yeah, when we began with about 4 orphans. Then later the number grew to 8. Then now we have 18 who are at least sponsored, and we have about 300 in the whole village which we surveyed. And the wider community of where I come from, there's many more. And what practically we are doing is helping them to access quality education, that is primary and secondary. We also help them to provide clothing. We also help to provide food and shelter. Most of these orphans have lost both of their parents, and there's nobody left to give hope to them, to cling to. Some have been left to stay with grandmothers who are elderly and are unable to work or have income to support them. So that is a huge problem in my village. So those are the areas where we are touching. In the community as whole, we are in the rural area, and there's no work where somebody can get employed. So people depend on the farm. And the farm, sometimes crop fails, sometimes there's no rain, like some years we have drought. So it is a big issue for people to get even nutrition. So Project Aid has done some impact in the community by providing water through digging a borehole. And last year we installed a play pump. So the children will come and play on the play pump, merry-go-round. At the same time, this play pump water to a nearest tank. So that water is accessible to the women and to the community. In our community, people carry water in their heads, and they walk very far. So now the water is now nearby. All the same, this water can also be used for irrigation. We have a farm which we are planting some vegetables to the community, and also this water also help to water the animals in the village. So this has been a great success in the last year. We also have some animals, goats, which provide milk, and some cows. And a child will go to school, have drank some milk from the goats and from the cow. And this is practically, to me, I think that was one of the things, because some when we went around talking to their relatives, some were going to school without drinking anything. And we hope that when the numbers of goats grew, we are going to give to a family who is taking care of an orphan a goat. So our resources have been limited, but as time goes, I think we are going to improve to reach more orphans. Because each day, like last time when Paul was visiting, I had 3 new orphans which I didn't have their names. They came when they heard that we were giving the nets.
Right.
And I could not deny them. Their parents died within that week. So the number is increasing. That is a big problem to us.
Tell us how big the village is that these 300 orphans are.
Yeah, the 300 orphans were located in one village of about 5,000 people.
Right. So what? A little less than 10% of the village orphaned. And of course, you've talked about the play pump and the goats. Are there other things that you're particularly moving towards? I know you've got in the dreaming stage a health clinic.
Sure.
but other things, what else?
As I mentioned about disease, actually I read something about the epidemic of HIV/AIDS, the virus, the disease, death, and the societal decomposition. And that broke my heart, because like now I think most of what we are doing is the decomposed side of it. We deal with the death painfully. Disease, we work with it, and the disease need to be managed because it comes with other what we call opportunity infections. So we are moving towards to have a clinic nearby, because Kandaria, maybe 50 kilometers around it, there's no good health clinic. So our dream of building a clinic will really provide quality, accessible medical care to the orphans, to the old, to the people infected, and even to the general population.
Just supporting the health of the community in general, keeping everyone as healthy as possible is the important thing. That's
and also we're talking how we can also improve the standard of education in the schools around there.
We talked this morning around coffee about the possibility of maybe having a food service or a lunch program at the schools, because the United Nations has done studies, and children that are well fed before school are going to study and learn better, but yet some of the children have to go to school hungry. So we thought, we've been trying to strategize on what we can do simply to impact the lives of the children. So maybe a school program where we can provide food several days a week. That would certainly increase attendance as well. David, also, we came to realize after an email that David sent us that many of the children don't have good shoes. And of course, shoes are important to prevent from cuts and blisters, but also parasites. And they have to have shoes to go to school. So kids were wearing flip-flops in, rough terrain, muddy, rainy terrain, and getting sick and all of this. So David took some of the orphans to buy them shoes one year, and then last year we had an opportunity for folks in Paducah to buy shoes and a pair of socks for the kids in Kandaria. And that was very exciting for us to see the kids with their shoes. And when I was there in September, David pointed out several of the kids who had the shoes on that we helped him buy.
Actually, the shoes did well, because when we were giving out the shoes last year, I identified 3 of the kids with what we call jiggers. Jiggers is a parasite which just embed in the foot nails. It is itchy at night and make them walk with bad gait. So we hope that the shoes will improve their condition. Malaria is also one of the major killer in the tropics. And I think it says maybe every 10 or 20 minutes somebody is dying of malaria. A child is born with malaria. And as Paul mentioned about the nets, we had about 300 nets and more which we have given to the children. And they wrote letters to us saying that now I don't have a mosquito bite, I can have a good night, I can have good dreams. And that is a real impact, and I thank the people of Paducah for that donation. Yeah.
So I'm trying to imagine what it would be like to be one of these children in Kenya. Did they tell you what this means to them to be on the receiving end of some very important and helpful things? What would a child think about this?
I think most of them are showing gratitude, because recently when Paul and Nathan were visiting, a group of kids were following us, and one was singing, "We need shoes, we need shoes, we need shoes." So I think these are the kids whom did not get. So I think they appreciate what has been done to them.
That's very interesting. obviously we've all heard about the sort of massive, enormous projects and the big ticket kind of ideas and ways to distribute things in need. But this is a very interesting local effort, local people making a difference in another local area, sistering up in very interesting ways, and you two are a part of that. You go over there regularly then, as well as David come here?
Well, this is the first time that we've been able to bring David to Paducah. But in the last 3 years, I've been each of the last 3 years, and usually have taken someone from Paducah with me. One of the first times I was in David's village, a lot of people looked at me and the clothes that I had on, the car that I was driving, which, by the way, was a 20-year-old Toyota Land Cruiser, and they looked at me like I was the richest person in the world. They looked at me the way I look at Bill Gates. And I realized that I am the richest person they will ever see. And most everyone has heard about what Oprah has done in South Africa and helping orphans there and providing a school, and what the Gates Foundation is trying to do. And I think in a small way, I am Bill Gates to those kids, and I am the guy who has all the resources in the world. And what little I do have, I can do something with. Bill Gates and his foundation are trying to take care of the entire continent. I think it's the appropriate scale is what I'm doing with my resources is helping a community of about 3,000 to 5,000. And the exciting thing is it doesn't take a whole lot to have a huge impact on the life of folks over there. 2 years ago when we went to Kenya, we were taking things to David. We were looking for ways to pack those things in our suitcases so they would be safe. So my wife went to the store and bought a bunch of t-shirts and packed everything, and we gave the t-shirts to the kids when we got there. And then last year we went back and brought more gifts, and the fellow that was with me said, "Hey, check it out, Daisy's wearing the t-shirt we brought last year." And David said, "That's because that's her only t-shirt. She has her school uniform that she wears to school, and when she gets home, this is the t-shirt that she has." And actually a lady at your church came up to us one day and said, "All I've got is $2. Will that make a difference?" And my wife had bought t-shirts for $2, and we took them back, and I thought of that lady, and I thought, with $2, this lady doubled Daisy's wardrobe. So it doesn't take a whole lot to have a huge impact on the life of these kids. So we can't help but try to help.
And the same way with the larger projects. The health clinic, if we imagined a health clinic in Paducah, it would be an enormous effort, but in Africa that happens a little more reasonably in a proportion that we can, in conjunction with you, help provide here.
Well, the exciting thing about the health clinic is it was David's idea to provide, and the way in which healthcare would be provided was going to be appropriate. We hope to hire all local craftsmen to build the clinic. We hope to buy most of the equipment from local vendors. There are organizations throughout the world, and specifically in Kenya, that provide medication at a reasonable cost for the conditions that they would be treating there. So several very generous people in Paducah have given money. We've bought the land. We've got the architect's plans all ready to go. We're just waiting for the rest of the funding to start the program. And then I'll let David talk about what we hope to accomplish, or what they hope to address some of the problems in the community.
The other portion about the children is after they have done their ordinary level, which is grade 12. What next? And we hope that we pray and hope that they will get scholarship, and maybe they can get good jobs. Maybe they become nurses or doctors, and we hope that they will come and bring the input back to the community.
Yes.
And I hope that will be, I think maybe will be the circle will just go like this one, so that when they come to the program, they benefit and they come back. And I think maybe after 50 years, maybe I will not be there, there will be some life in the community.
Mm-hmm.
And Paul mentioned about the clinic. The clinic also, I think, will improve the health care of the community. As I mentioned earlier, that the transport in Kenya in rural areas is very bad. There's something like a road. I was envy about Paducah, telling Paul everything is smooth here. And we drive in Kenya, the roads are bad. And imagine taking a patient who is in labor in such a situation on that road. It will be awful. So I think the clinic will just be a good starting point to improve the health care of our people. We mentioned HIV. There are medicine which can be given to a pregnant woman at labor, which can help to or prevent the transmission of the virus to the unborn child by about 40%. And if that thing is not available, and then the child is born, then we are talking of a child who is going to die within a few months before the first year. So by having a health program nearby, I think that will help prevent that.
And I feel like I happened into this friendship, and I've happened into this privilege of helping David. And in the last 5 years, I've had to do a lot of reading to find out what are other people doing. We are shamelessly taking ideas from other people who are doing what we see this community as needing. And the more I read about it, the more obvious the correlation is between poverty and HIV, between poverty and poor health. So, and there's the same relation between poor health and poverty. So if we can address some of the health issues, then people don't miss days of work. If we can address the issues of malaria prevention, then kids don't miss days of school, then they can compete nationally within Kenya for positions in the good schools, and they can complete their education. So there's a lot of just really simple things. Access to good, clean water, which we've fortunately been able to provide for them. Protection from malaria, which we're halfway there, I think, for the entire community. So we're doing some real exciting things. And one of our big projects is a health clinic. In the same way that just a couple of dollars, I think from the lady at your church, there's got to be someone in Paducah for who $50,000 is that easy to give, or any portion of that kind of money. Any little bit will help to build a health clinic.
That's neat.
There's a group of nurses in Paducah that have talked to us actually this morning about providing a scholarship for one of the students that would graduate high school and would want to go on to nursing school. And we've talked about some kind of a community service. We'll pay for 2 years of nursing school if you come back to the community for 2 years. And we're trying to find creative, resourceful ways of investing in the community.
And folks who would be inspired to participate, you know, in a humble way or in a grand way, how would they be in touch with Project AIDS Orphan?
Well, we have a website, like everybody else, projectaidsorphan.org. And they can also call, I'll give you my cell phone number, 556-8241. Call me anytime. Our website has a catalog of things that people can buy, such as the goats that David talked about, mosquito nets or shoes. You can also assist in a famine relief and buy a Christmas food basket for a family. Or there's donations either to our general operating fund or to the health clinic. There's more information on our website, or certainly call us or call me, and I'd be happy to come talk to anybody anytime about what David is doing.
And one of the things that is so beautiful about this is, you know, lots of times, particularly at this time of year, folks are inspired to give. It's marvelous because you know where it's going, and you know what it's going to be. You know it's going to be a pair of shoes, or it's going to be a mosquito net, and there's something, and you know that those shoes are going to go on a child's feet, or that mosquito net's going to go over a child's bed, and I think it's so important for that gift to be felt in a very particular way rather than a general way.
I mean, we even have pictures, don't we? Don't we have pictures of those children and the actual terrain and setting where all this goes. I think that's an interesting thing to note and take a look at.
And one of the exciting things for me is I do get to go back, not as often as I would like to, but I do get to go back and see the kids. And it is exciting to be recognized when I'm with David as one of the people who comes to help.
That's neat.
And I think about a village of children who grow into adults who are familiar with Paducah, Kentucky, for no reason other than love and generosity. That's a beautiful thing. Well, we just have a couple moments left. What have we overlooked? Anything that you want to be sure that our viewers know in just a moment or two?
Well, one of our slogans, the whole concept of HIV and poverty and poor health and economic disintegration is very complex. It's incredibly hard. I feel relatively well versed but incredibly ignorant of the whole problem. But one of the exciting things is our slogan is, the good news is it's easy to help. It doesn't take a whole lot of effort on anyone's part. I am shocked at how easily the World Health Organization was willing to sell us mosquito nets just after about a dozen or 15 emails and a few phone calls, and showing our legitimacy, they were willing to work with us. So it really is easy if someone wants to put their mind to it and someone wants to help us or participate with us in helping their community. And the rewards of seeing the impact on the lives and in the lives of the kids there is really exciting.
Phone number again?
556-8241.
One more minute, David. What do you want to tell us here in the last moment?
Love in action. I think love is an active verb, and I think the people in Paducah has shown that love to our Kenyan people, and I appreciate that, and a big thank you. And we hope that this week, as we approach the World AIDS Day, they will come out and participate and support us. And I think that's the message I can give, and thank you very much.
Yeah, great. Good program. Thank you very much for being here, and more importantly for what you're doing across the world to connect us in important ways. We're glad you have been here with us as well. This Reflections program, we hope you'll join us again for our next program, and wherever you are, do God's work with human hands. Shalom.
Shalom.
Shalom.